As we celebrate Global Health Action's 40th anniversary, we especially want to thank each of you, our founders, our friends, and our faithful supporters over all these years. Together, we are celebrating 40 years of advancing the health of individuals and communities around the globe. We have continued our mission through education, training, and on-the-ground programs. We owe so much to our founders, Dr. Ada Fort and Miss Virginia Proctor, and to our longtime president, Frances Candler Shumway. These three visionary women were dedicated in establishing a vision for global health action and a mission that is timeless. In the late 1960s, Dr. Ada Fort and Virginia Proctor, then leaders at Emory University School of Nursing, recognized the need and were inspired to help foster healthier communities in developing countries by building the organizational leadership and healthcare delivery of skilled nurses to better serve in their countries. Together, they recruited and inspired leaders from Atlanta's health, religious, business, and educational communities, and Global Health Action's precursor, the International Nursing Services Association, INSA, was born in 1972. The mission of Global Health Action was not only to improve the technical health skills of international health professionals, but also to build their administrative and leadership capabilities to better serve in their countries, to run programs, health facilities, and organizations within their own countries. INSA continued to evolve over the years, and in 1980, nurses were joined by physicians, public health officials, and other health leaders, and the programs in Atlanta were complemented by in-country programs, first in Haiti, then in India, and Jamaica. In 1982, we established INSA India as a nonprofit health organization based in Bangalore, India, to prepare the grassroots health leaders to provide health in their own communities and their remote villages. Fully staffed by Indian nationals, INSA India now marks 30 years of service and is currently considered a second-generation organization, financially and administratively independent from us. In 1993, our name changed officially to Global Health Action to better reflect our expanded health outreach. Now, 40 years later, the underlying philosophy and mission which inspired our founders in 1972 are still the basis for what we do. We have enhanced the skills of thousands of health providers and community leaders from 97 countries. Today, Global Health Action continues to build the skills of the in-country leaders to help strengthen local health systems. In partnership, we design and implement community health and development programs to help meet the needs in underserved areas of the world, like Haiti and rural China. At the request of local partners, Global Health Action has been working in Haiti now for more than 30 years, primarily in the Léogâne district, the epicenter of the 2010 earthquake. Our Haitian staff works to improve the income and nutrition of rural Haitian families through our GOAT program, where each month new classes of farmers receive training in goat husbandry and care, plus the gift of a pregnant goat crossbred with an improved buck. Our newly trained animal health workers provide goat care and goat breeding services in the mountainous zones as well. GHA trains and supports a cadre of Haitian health workers to serve the needs in their rural communities. Their training in basic health care and health promotion equips them to prevent or treat 80% of the diseases and illnesses in their local area. In Haiti, we work in partnership with the District Ministry of Health and the Methodist and Episcopal Churches of Haiti by building the skills and supporting the services of community health workers and traditional birth attendants, department leaders, and the staff of permanent and mobile clinics. In China, Global Health Action partnered with the Heilongjiang Public Health Bureau in rural northeast China to train over 10,000 primary health workers. They provided education and care for more than 1.2 million rural women about reproductive health, disease prevention, and domestic violence. In partnership with local Chinese health officials, community leaders, and school teachers, our newest program in China is the Left Behind Children's Program, to develop an adolescent health education program for boys and girls ages 11 to 15 for access and information for psychosocial support and health care. The pilot program is in rural Funing County, where 1/3 of the parents have migrated to the bigger cities for work, leaving their children behind in the care of grandparents or elder caregivers. The challenging economic climate in China has resulted in over 58 million children being left behind in rural areas far from their parents. Thanks to Global Health Action, much-needed school computers have been provided for these left-behind children so that they can arrange a free video chat with their parents who are living and working in big cities far from their rural hometowns and villages. This is just a glimpse of our history and our current outreach, and each of you is an important part of what Global Health Action is today. And I know you have your own stories to share about how many people involved with Global Health Action have touched your life as well. On behalf of all the staff, I thank you so much for your ongoing support and your encouragement as we strive each day to improve the health and the quality of life in the places we serve. Thank you so much. And now it's my honor and privilege to introduce one of our longtime board members, Kathleen Eidson. Kathleen has been with Global Health Action from the beginning. In fact, she helped at some of the first graduating class receptions way back in the early 70s. She has served on our board as vice president and treasurer, and now as board director emerita, and has been involved with us from the beginning. So here is Kathleen to share a personal perspective about her involvement with GHA. Kathleen?
Throughout the world we recognize a very pressing need. The call for better health is one that everyone should heed. We have an organization well equipped to meet that need. We must go bravely on. From many countries they have come to maximize their skills. Returning home, they work to minimize their people's ills. Our work with worldwide countries now a broader mission fills. We will go bravely on. Global health is our ambition. Global health will be our mission. Let us now have done with wishing. Help us go bravely on. And it has indeed been my privilege to be involved with Global Health Action since the beginning. It's amazing that two visionary women, Ada Fort and Virginia Proctor, could transform their dream of healthy individuals, healthy countries, healthy world into a possibility. And yet it came true. From the very first training session in Atlanta in '73 of 5 participants from 3 countries to the present day worldwide, over 90 countries involvement of our graduates and our in-country projects. It has been my privilege to visit and know firsthand the worth of an organization is not just words, but it is, does it really make a difference? And I have seen that it does. In 1984, Francis Candler Shumway and I were in Ashta, India, where a training session was going on. And yes, that was the weekend of the Union Carbide disaster. And it took coordination of so much of the Indian population. One of our graduates was named Nurse of the Year for her help in that perilous time. It was in Nepal that I ran across another of our graduates. It was a 300-bed refugee hospital for Tibetan refugees, and it was headed by one of the health workers who had received training in Atlanta. I have also visited work in Chiang Mai, Thailand, in Nairobi, Kenya, and it has always struck me that the difference it makes. Our Haitian ongoing project has been a favorite of mine, perhaps because I was called on a visit there one time to present the certificates to the graduates of the training session in my half-remembered high school French. But wherever our graduates go, the ripple effect is amazing. It reminds me of our work, Global Health Action, global, worldwide, health, the healthy individual, healthy countries, healthy world, and action, not just talk, but doing things that make the difference. It reminded me of a story of a little pig and a little hen who were walking down the main street of a country town, and they saw the signs, bacon and eggs, ham and eggs, sausage and eggs, and the little hen strutted before the pig and says, "Doesn't that just make you just feel how important we are in this world?" And the pig looked at the little hen who was dancing around with great enthusiasm and said, well, it's all right for you to talk. With you, it's just a contribution. But with me, it's total commitment. And to me, global health action represents total commitment. Not just talk, but action. And I am sure that global health is committed totally to continuing the great work it is doing, and I know that I am committed totally to global health action.
It's now my honor to introduce our keynote speaker, someone that we know at Global Health Action very well. Dr. Patty Simone is the Principal Deputy Director for the Center for Global Health at the Centers for Disease Control and Prevention here in Atlanta. She's second in command there at the Center for Global Health and is involved in providing programmatic leadership, supervision, and coordination of their global health programs and functions. So as you can tell, she has an extremely large job. Dr. Simone received her BS from Stanford University and her MD from the University of Tennessee Medical School. She has served at CDC since 1992. She works in a variety of areas prior to being the Deputy Director for the Center for Global Health, has a wealth of experience in many areas. In addition to her work as the Principal Deputy Director at CDC for the Center for Global Health, she also serves at a TB clinic as a TB physician here in Fulton County, and serves as an adjunct faculty member at Emory University. In addition to that, Dr. Simone, Patty to us, also gives of her personal time and expertise to Global Health Action as one of our board members, and we're deeply grateful for that. It's my honor and privilege to introduce Dr. Patty Simone, who will bring the address to us. Patty?
Good afternoon, everyone. Thank you very much, Robin, for that nice introduction. I'm really happy to be here today, although I didn't realize what a hard act I was going to have to follow. I have a few things I'd like to speak with you today about the current challenges and priorities in global health. These are just a few of my thoughts in this area. I do want to mention that these are my personal feelings and not an official representation from CDC. So I thought I would touch briefly on 4 different areas. First, the challenges and priorities for global health are affected by the interconnected world that we live in. I want to talk a little bit about the unfinished business of infectious diseases, the new challenges of non-communicable diseases, and the concept of country ownership and sustainability. So there are a lot of public health risks from the fact of the way the world has become globalized. There's increasing migration, increasing urbanization, there's increasing trade, including of things that may be harmful, commercialization and distribution of food, spread of medical technology, drugs, and commodities. There's diffusion of cultural practices, and I put Ronald McDonald here to show you that we export things that maybe aren't so good to other countries around the world, our taste for fast food, for example. And scarcity of natural resources and environmental climate change. All of these can actually affect public health risk by increasing exposure to people, by bringing more people together, by bringing animals and people closer together, and increasing the likelihood of exposure to infectious disease, but also increasing exposure to unhealthy behaviors. And now these things move very, very quickly throughout the world. In less than a day, anything can be from one place to another throughout the world. This is just a map to show you the percentage of people that lived in urban settings in the world in 1975. So about 37%. The dots represent the population of the cities, so the large red dots are over 10 million or more people. So just keep an eye on those red dots, and you'll see what happens. That the projection for 2025 is for 56% of the world's population to live in urban areas. Urban areas have, like I said, crowding, risk of transmission of diseases. They don't have safe water, so a lot of different public health risks for this trend. This is a complicated slide, but I put it in here because I wanted to show you about this idea that infectious diseases could move around the world so quickly. This is an example of the chain of transmission from SARS. I don't know if you remember the SARS outbreak in 2003. It's a virus that started in China and actually started in the markets where the humans and the animals were in very close proximity. The first case was in a Hong Kong hotel, and very quickly, after exposure in that hotel, it was spread throughout the whole world. So this is just a graphic example of the spread that happened from SARS. It spread to 24 countries throughout the world. More than 8,000 people became sick, and over 700 people died. And there were 8 cases here in the United States. I worked on that outbreak, and we had it was a huge amount of work. It was involved so many different people, and it was estimated that it cost the world economy $30 billion to have this outbreak. There was interruptions in trade and travel.